Hello, in this video, I'm going to tell you all about spinal stenosis. So, spinal stenosis refers to the narrowing of either the vertebral canal or the intervertebral foramen, or sometimes both. So, the vertebral canal is this kind of hole, it's a canal that runs down the center of your spine. So this is a vertebra, and in this picture here, this also shows the intervertebral disc on top of the body of this vertebra. And in the posterior portion, we have this hole. And so when we stack up all the vertebra, or all the vertebrae on top of one another, it creates a canal. So this whole long, narrow space where the spinal cord sits. So stenosis is when that space gets kind of closed in. It starts to become more and more narrow, and there are all sorts of things that can cause that narrowing. So I'll talk about that in a minute. Then the intervertebral foramen, those are the spaces that are kind of on the lateral side of the vertebrae that allow the spinal nerves to exit the spinal cord and go out to the periphery of the body. So here in this picture, you see where those spaces are sort of narrowing in, and it's pinching those spinal nerves where they're exiting the spinal cord. So in either case, that's referred to as spinal stenosis. Stenosis in general just means narrowing of a space. So you see that word used in other places too. So spinal stenosis also increases the stress on the facet joints, which are the joints that are connecting one vertebra to another. There are actually many different joints in the spine that are connecting all the different bones together, and the facet joints are just some of them. It also causes compression of the spinal cord and or spinal nerves, depending on where the stenosis is taking place. So if it's the intervertebral foramen, then that would cause compression of the spinal nerves at their root where they're exiting the spinal cord. And if it's stenosis of the spinal canal, then that would start to encroach and impinge on the spinal cord itself. So signs and symptoms. So first, a lot of people actually have spinal stenosis and have no symptoms at all. So they never even realize it. Then symptoms gradually come on and worsen over time. Those symptoms in general, when it's symptoms of back pain or when the symptoms are in the spine or in the back, it would be pain, tingling, numbness, muscle weakness. Those symptoms can also radiate and affect the arms and or legs, depending on where the impingement is occurring. So if the problem is in the lumbar spine, so down here in the low back, it can also cause pain or cramping in the legs when you're standing for a long time or walking. And that pain or cramping would improve if you bend forward or sit, because it would relieve the pressure on the spinal cord or on the nerve roots, depending on what the problem is. And then that would lessen the symptoms. It also sometimes occurs in the cervical spine, so that's in the neck, way up here. And if that's the case, then it's more likely to cause symptoms that radiate out to the arms. Can also cause problems with walking and balance, and it can even cause problems with the bowel or bladder, just depending on what exactly is being impinged. All right, so how does this happen? What causes it? It can be caused by congenital abnormalities, meaning things that you're born with. So certain spinal conditions like scoliosis can increase risk of spinal stenosis. And then some people are just born with more narrow spaces in the first place. So they might be more prone to developing pain and dysfunction down the road, because if the space is already kind of narrow, it just takes the tiniest bit of narrowing any further than that to then start experiencing those symptoms. It's also caused more commonly by wear and tear on the spine. So like arthritis that is caused by wear and tear. So that can result in bone spurs, so like extra bone that grows in different areas. Can cause herniated discs, which is when, our discs are kind of like jelly donuts. They got this gel inside. And so if we put too much force or move in the wrong way, we can actually rupture the disc, and then the jelly squirts out of the jelly donut, and that's a herniated disc. So that can, if the disc herniates, then the jelly would sort of impose on that space. It would encroach on the spinal cord or the spinal nerves and cause an impingement that way. It also can be caused by thick ligaments. So sometimes part of arthritis or any kind of overuse or wear and tear, sometimes what happens is the ligaments can get stiffer and thicker. So like our ligaments should be somewhat viscous almost, like the fluid in between the strands of collagen should be pretty fluid. It shouldn't be super solid. So there should be some flexibility and movement. And so sometimes the ligaments can sort of thicken up, they can get stiffer and less viscous and more toward the solid end of the spectrum. And so when that happens, that thicker ligaments can start to encroach on those spaces and cause stenosis. In rare cases, there could be a tumor. So rarely tumors do form inside of the spinal canal, and in that case, it would press on the spinal cord and cause all of the same symptoms. And then finally, spinal injuries, so things like car accidents or athletic injuries, things like that, can also result in fractures, bones that are not quite in the right place, swelling of tissues, all of which can interfere with those spaces that we discussed and cause stenosis. All right, so the severity is determined by MRI. So if you have an MRI done of your spine and it comes back with absolutely nothing, you're totally normal, it would be called a grade 0, and then it goes up from there. So a mild stenosis is grade 1, moderate grade 2, severe grade 3. All right, so there are surgical and non-surgical treatments. So I'll talk about the non-surgical first. So there are some medications that you can get over the counter or that might be prescribed to you just depending on the potency. So like NSAIDs, non-steroidal anti-inflammatory drugs, you can get those over the counter, or they might prescribe a higher potency, a higher dose to help with the pain and inflammation. Some antidepressants can actually ease chronic pain, so they might be administered. You take them at night, and they might help with pain in general. There are some anti-seizure drugs that actually can reduce pain that is caused by damaged nerves, so those might be useful. And then finally, they sometimes prescribe opioids, but of course, these are habit-forming and best to avoid if any other options are available, if anything else works for you. But they are there if it comes to it. Then also physical therapy can be helpful because you can improve strength, endurance, flexibility, stability, and balance, all things that suffer in the case of spinal stenosis. Steroid shots might be an option. It's usually not the best. It's usually not the best route when it comes to spinal stenosis because they also further weaken bone. And so in the case of spinal stenosis, that's not exactly what we want. It can cause weakening of bone and other further problems. So it might help for a little while with pain and inflammation. Might be good to do once and see if it helps, but it's not something that you want to do ongoingly because it will continue to degenerate and make the problem worse ultimately. There are also certain needle procedures that can be done. So in the case that it's thick ligaments that's causing the problem, they can actually do these procedures where they put needles in and remove parts of, just little teeny bits of ligament to help create a little bit more space and try to soften up the ligament. All right, then when it comes to surgical treatments, there are 3 options available. So laminectomy, that's the picture all the way on the left here. That's where they remove the whole back part of the spinal bone to ease the pressure and create more space. So like what we see in the picture here, they would remove this entire piece off the posterior portion. So it would just completely relieve that pressure. There's no more issue at that level of the spine. Laminotomy is the picture in the center here. This is where they would remove only part of the back part of the spinal bone. Instead of removing that whole thing, they would remove just a little piece of it or create a hole in a specific place where there's narrowing so that it would relieve that pressure and allow for that space that we need. And then finally, a laminoplasty, that's the one all the way on the right here. It is only done in the cervical spine. The cervical vertebrae are much smaller and the bone is thinner, so it has to be treated a little bit differently. So it's only done in the cervical spine. It creates a hinge on the back part of the spine to open it, create more space, and bridge the gap. So essentially, they're removing a little piece here, and then they're opening it up a little bit like a hinge, and then they're bridging it with a piece of hardware. So they're connecting it and enclosing it with a piece of hardware, but they're doing it in such a way that they're expanding the space and allowing for more room than the original bone had allowed. All right, that's all I have for you in this video. Thank you so much for watching.